A recent study revealed a gut-related cause of bad breath. And interestingly, when treated, those who resolved the underlying cause of bad breath saw a corresponding 99% resolution rate of their bad breath. So today, let's cover what this gastrointestinal cause of bad breath is, how the researchers in this recent study treated it, and then provide a few additional tips and recommendations for how you can resolve bad breath if you're dealing with it. The study in question comes from 2024, the Journal of Breath Research. Part of the rationale behind this study was wanting to better understand what causes what's known as idiopathic halitosis, bad breath of no known cause. So quoting from the researchers, idiopathic halitosis is an unusual condition of unclear cause, which has never been thoroughly investigated. To date, no association between SIBO, small intestinal bacterial overgrowth, and halitosis has been definitively established. We hypothesized that SIBO might be the underlying cause of idiopathic halitosis. So how did they assess this? They took 162 subjects with unexplained bad breath. They tested them all for SIBO. A quick detail here, they used a lactulose SIBO breath test, and they interpreted the breath test, importantly, according to the North American consensus criteria, just as a few details as an aside. They also ruled out other potential causes of bad breath. So this would be an oral infection, thrush or candida, GERD, reflux, diabetes, liver or kidney disease, just to name a few. Okay, so then how do they treat these people? They were given a probiotic daily for 2 months. We'll detail the protocol here in a moment, but let me give you the high level first. Again, what they found was in those who resolved their SIBO, there was a corresponding 99% resolution rate of bad breath, which is pretty remarkable. So this then follows, well, how effective was the probiotic intervention at clearing the SIBO? 80% of people who were treated with this probiotic protocol resolved SIBO. Again, remember that of those 80, 99% resolved their bad breath. Some of the context here I just wanted to speak to in brief is you may have heard that if you have SIBO, you should avoid a probiotic. And really at this point, nothing could be further from the truth. Now, if we were going back 10 plus years, I think that was an understandable hypothesis because we didn't have enough information to really answer the question. But now that we have well over 20 clinical trials and a study like today as another additional case in point, there's really no excuse for any healthcare provider recommending to avoid probiotics when they have SIBO, small intestinal bacterial overgrowth, due to the high level of efficacy and the very low incidence of adverse events. Oh, and by the way, if this is helpful, please comment. I'm always curious to engage. Subscribe so you see future videos from us, and share with someone you think this might help. As we work our way to some of the specifics, we should take a moment just to explain how it is that SIBO causes bad breath. SIBO will lead to the creation of what's known as volatile sulfur compounds. These are produced by certain gut bacteria. They have a smell of radish, cabbage, or this otherwise sort of sweet but unpleasant odor. And these compounds are not broken down by the intestinal bacteria. Therefore, they are absorbed into the bloodstream and then eventually off-gassed through the breath. The discovery of these compounds actually goes all the way back to 2007. Tagman and Winkle discovered dimethyl sulfide as a cause of bad breath, but they didn't know where it came from. And that's the really key thing about today's study is now we know that the dimethyl sulfide is the specific compound in the breath that causes halitosis, but perhaps more importantly, that is coming from the dimethyl sulfide, the DMS, coming from intestinal bacterial overgrowth. I should also mention that this is different from when we look at a SIBO breath test, we can assess for hydrogen gas excess, methane gas excess, and even hydrogen sulfide. These are all different and not what these researchers quantified in the breath. So this would not be something that you could, let's say, tack on to assessing in a SIBO breath test. And this test for the dimethyl sulfide is not routinely available. And in a way, you don't really need to do this test specifically because if you test for SIBO, that's really what you treat to resolve the cause of the dimethyl sulfide, this malodorous gas, to begin with. And just to remark on the conclusions from this study, I wanted to quote a few thoughts from the researchers. This study identifies SIBO as a novel cause of halitosis, bad breath. We recommend investigation of SIBO in cases of idiopathic halitosis, as well as considering probiotic treatment if SIBO is confirmed. So just wanted to make sure to drive that point home that if you have SIBO, more and more research demonstrating what SIBO can cause, in this case bad breath, but perhaps most importantly, that probiotics are a frontline therapeutic consideration. Okay, let's go to the protocol. How did the protocol work? Quoting again from this paper, probiotics reach and colonize in the small and large intestines. They compete with intestinal pathogenic microorganisms for adhesion or residence sites, thereby restoring the balance of gut flora. And this is where it gets really interesting. Fermentation in the small intestines, fermentation, by the way, that's what produces these volatile sulfur compounds, as well as other gases like hydrogen and methane. But fermentation in the small intestine is inhibited, and subsequently, production and exhalation of volatile compounds are reduced. Great. Now, specifically, they use a probiotic called the triple viable tablet. This probiotic was used in a dose of 1 billion CFU per day for 2 months. It contained 3 species of bacteria, a lactobacillus, a bifidobacterium, and an enterococcus. I did some searching, and this probiotic does not seem to be easily located online. So perhaps it's a US thing where it's not distributed in the US, but nevertheless, there's the specific formula. Here is a protocol that we recommend and we use at the clinic. We broaden the protocol out a little bit to be a bit more comprehensive using what we call the 3-category approach or triple therapy probiotic. Now, if you take a big picture view on probiotics, we can comprise this heuristic to organize them because there's so many species and strains and formulas. It can be hard to sort of make sense of it all, right? So the categorization system that we've been using, and we're actually working on a paper for a medical journal to sort of support this as we speak. The first is the traditional blends of lactobacillus and bifidobacterium. So this would be your first type. Now, the second type might be the most relevant if someone suspects they have a fungal overgrowth, which can also cause bad breath. We'll come back to that in a second. And the probiotics here are Saccharomyces. This is a healthy fungus. And then third and finally, a soil-based or spore-forming probiotic, oftentimes with species of the Bacillus designation. Now here's the relevant tie-in. All 3 of these different formula types have independently been studied and demonstrated to have high efficacy for the treatment of small intestinal bacterial overgrowth. The principle that we're applying here is that combination therapy is generally superior to monotherapy. We know, for example, that more than one antibiotic, if that's the route you're going to go for SIBO, is better than just one antibiotic. The same thing applies for herbal antimicrobials. Some studies are suggesting that using a multi-ingredient herbal antimicrobial blend is superior than using just, let's say, berberine alone, although both can be effective. If there's other types of chronic infections or in the context of other types of chronic infections, more than one antibiotic is often used. For Lyme disease, for Babesia, this sort of protozoal parasite, for Bartonella, it's clearly, at least based upon anecdotes, and there's some research from Richard Horowitz and his Dapsone protocol, that multiple antibiotic interventions are superior to just one agent alone. And also for histamine intolerance or mast cell activation, it's fairly common practice to pair, let's say, a histamine antagonist for receptor class 1 and 2. And to make this maybe even the most practical and relatable, if you were trying to have the highest level of physical fitness, ideally you would do a combination of strength, endurance, mobility, and plyometrics, right? Just as an example. So this concept that a broader therapeutic approach is better than a sort of mono or narrow therapeutic approach is the same thing that we're sort of encompassing with the triple therapy probiotic protocol that we recommend. So here's the specifics behind our protocol. So you have all the options to try maybe the one therapy, and then if that's not totally sufficient, you can go to the triple therapy approach. With the Lactobacillus bifidobacterium blend formulas, this is where when you look on the label, you'll see usually anywhere from about 4 to maybe 12 different species of Lactobacillus and bifidobacterium. There have been hundreds of studies using different derivations. It doesn't seem that there's a really clear indication that one formula per se is superior to another. These are used at a dose between 1 to 50 billion CFU per day. Now, in this study, they used 1 billion. So it poses the question, well, if we used a higher dose, would that be better? Not necessarily. The data here are still in their nascency, but at least the early trend in the data is suggesting it's not necessarily using a higher dose that's better, but a longer duration. Because some studies, again, it's not many, but have looked at this, and it seems that the longer time course is more effective than the higher dose. For the Saccharomyces, either Boulardii or Cerevisiae, 2 different species of Saccharomyces, respectively a dose between 10 to 15 billion or 4 to 8 billion CFU per day. And then finally, with the soil-based probiotics, this is the various bacillus species, anywhere between 2 to 6 billion CFU per day. Now, this also begs the question, well, what about foods? What about fermented foods? Is this a viable way to obtain the probiotics in my diet and not need a supplement? And the answer is yes, but maybe. Yes, in the sense that you can obtain adequate probiotics from food. Maybe in the sense that there aren't really any good clinical trials giving people with SIBO fermented foods and documenting clearance. Now, it's not to say there are studies disproving the food can resolve the SIBO. It's just no formal study has been performed to date. So I think it's probably likely you can resolve SIBO with food alone. The one data point here I would share coming out of Stanford from 2021 journal Cell, they found that a high dose of fermented foods was actually better than a high dose of high fiber foods for improving microbiota diversity and for reducing inflammation. So then the follow-up question from this is, how does a probiotic supplement compare to fermented foods? And I'm going to give you 2 versions of this answer. Firstly, and this is way more than I can talk through, the detailed analysis. So what you're seeing in this image is a lacto-bifido blend probiotic compared to the dose per serving of sauerkraut versus yogurt versus kefir versus kimchi versus kombucha. I'll leave that for those of you who want to do a deeper dive. Here is the simplified version. Again, looking at a lacto-bif supplement, 1 serving versus kombucha, sauerkraut, yogurt, kefir, kimchi. So the probiotic, you're going to get between 1 and 50 billion CFU per day with most formulas. Remembering this study in question used 1 billion CFU per day. With the foods, you can get well north of that 1 billion. So hence why I say it is possible to get adequate probiotics through fermented foods. The only caveat here is depending on the quality of the food, there is a variance in the amount of probiotic per serving, and that's what you're seeing in this table. So for kombucha, there could be as little as 240 million up to 2.4 billion. So it's a pretty large delta in terms of the range. Sauerkraut ranges from 140,000 to 14 billion. Yogurt, 1.7 million to 170 billion. Kefir, 16 million to 250 billion. And kimchi, the most potent probiotic, it appears, Food, 15 billion to 1.5 trillion. So things you can look for to ensure that the food will have the highest dose would be refrigeration required, so it's not shelf stable, it has to be in the fridge, unpasteurized, and contains live cultures. Now, there's another point here I should weave in, which is some people tend to be a little bit intolerant to a decently high dose of fermented foods. These are people who exhibit what's known as histamine intolerance. They tend to have a runny nose when they eat, or rashing, flushing, hives, and lots of sort of seasonal, environmental, supplemental, or food reactivity. Now, ideally, we heal the gut in this case and improve their food tolerance. But out of the gate, if you are someone who's saying to themselves, well, I tried fermented foods and I got flushed, had a headache, felt anxious, irritable, had loose bowels, had a runny nose, whatever, then the fermented food angle may not be the best starting point for you, and hopefully would be something that as you heal your gut, you can revisit. I also wanted to address a few thoughts for if the probiotics alone are not sufficient to resolve the SIBO and therefore the bad breath. So without going into detail, just a few options to think about. A low FODMAP diet, which can starve the overgrowth, not used in perpetuity, but used as sort of a rebalancing intervention. An elemental diet, which can also help starve the bacteria and reset the gut. Herbal antimicrobials or pharmaceutical antibiotics like rifaximin for SIBO. And a prokinetic, which helps ensure food moves through the intestinal tract at the adequate pace, preventing stagnancy, and the stagnancy is what leads to, in some cases, overgrowth. And the final point or two here I wanted to make was the other gut causes of bad breath. We mentioned a moment ago fungal overgrowth, and this is another cause of halitosis, of bad breath. The biggest indicator here would be a white tongue. So if you have bad breath paired with a white tongue, it's more likely you have a fungal overgrowth, which is why it's encouraging to see from a 2019 meta-analysis summarizing 8 randomized controlled trials in patients with oral candida, the following comment. We are confident in declaring that probiotics can have a beneficial effect on reducing oral candida counts. This probiotic protocol can be applied not only to SIBO, but also to candida, or I should say a probiotic protocol. I also wanted to mention a few other causes of GI imbalances that have varying degrees of correlation to bad breath, with the good news preface that all of these have varying levels of evidence that they can successfully be treated with a probiotic. Dysbiosis. This is where there's not an overgrowth per se, but an imbalance in the community of gut bacteria. Helicobacter pylori or H. pylori, a bacteria that resides in the stomach, which probiotics also push down the population of this bacteria and get it back into better balance. IBS or irritable bowel syndrome, which oftentimes is accompanied by SIBO, but sometimes has other non-SIBO causes like leaky gut. Inflammatory bowel disease, as we mentioned before, and in inflammatory bowel disease, likely the probiotics are, amongst a few different mechanisms, modulating this toll-like receptor 4, which is a key regulator of this leaky gut inflammatory cascade that may be overactivated in inflammatory bowel disease. And then finally, reflux. And here's the interesting physiology pertaining to reflux, probiotics, and bad breath. We know that when people have a leaky gut, that or intestinal permeability that is excessive, that leads to increased immune system triggering, in part via that toll-like receptor 4 I mentioned a second ago. When the immune system is triggered, part of what mediates that response is histamine. And histamine, part of the allergic response, actually also signals and stimulates the release of stomach acid. So this is how leaky gut can lead to immune activation, can lead to histamine release, can lead to high hydrochloric acid release, can lead to reflux. And yes, some reflux is due to excessive acid production. Some is due to low acid production, but it's really important to underscore that, especially for those who have a lot of immune reactivity, food, supplement, environmental reactivity, what might be happening here is leaky gut, inflammation, immune activation, histamine release, high stomach acid. And interestingly, we have studies both demonstrating that probiotics can directly treat the reflux, but other studies showing in the model of environmental allergy that probiotics can lower histamine levels. So not to overly simplify this, but it's nice when we can see good evidence for one therapy being helpful for multiple conditions, because it can give you some focus with what, if you haven't done this yet, you could trial, and also with the triple therapy approach, a stronger protocol you can use if you haven't seen sufficient response from sort of a standard or entry level probiotic thus far. So in close, a few points of recap. Bad breath can be caused by SIBO. When resolving the SIBO, remember 99% saw a corresponding resolution of their bad breath. You can treat this with a single probiotic, with triple therapy probiotic, or with foods. And other causes, as we mentioned, may also be able to be remedied with the use of a probiotic. And I'll leave you with this quote that I think sort of demonstrates the importance of simplicity from James Clear, author of Atomic Habits. The highest level of mastery is simplicity. Okay, this is Dr. Ruscio. Let me know what you think in the comments below. Talk to you next time.